Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Gallbladder carcinoma, we are dealing with the TNM staging. So this is with respect to the 8th AJCC guidelines. So we start off with the T being the primary tumor. So the TX, as we know in all tumors, it means that it cannot be assessed. Next is the T0. T0 is transferred, there's no sign of the primary tumor. Then there is TIS, which means the cancer is only in the epithelium. So it is present only in the epithelium. And it is not grown into the deeper layers of the gallbladder. And is not grown into the deeper layers of the gallbladder. So it is not grown in the deeper layers of the GB, that is the gallbladder. Next we move on to the T1. So what is meant by T1? T1 stands for the tumor invades the lamina propria or the muscle layer muscularis. So the T1 means the tumor. It invades the LP, that is the lamina propria, or the muscle layer. Muscle layer, and that is, it includes the muscularis. Now we deal with the T1A. The T1A means that the tumor invades the lamina propria. So the LP, so the tumor, it invades the lamina propria. Now when you are focusing on T1B, 1B in particular means it involves the muscular layer. Now let's look at the T2A. T2A, it indicates that the tumor, it invades the muscle layer. So it invades the muscle layer and it is into the fibrous tissue on the side of the peritoneum. And it is into the fibrous tissue. It is into the fibrous tissue on side of the peritoneum, on side of peritoneum, and that is the lining of the abdominal cavity. That is nothing but the lining of the abdominal cavity. So this was 2A. Now let's look at 2B. 2B means that the tumor invades the muscular layer. So it includes the muscle layer. It is into the fibrous tissue on the side of the liver. So in 2A it was the side of the peritoneum. Here it is going to be the side of the liver. So side of the liver, and but has not invaded the liver. So it is not invaded. So side of the liver but not invading the liver. Then we move on to the T3. T3 means the tumor, it invades the serosa. So T3 means it invades the serosa and or it has grown directly into the liver. So it has liver, it is grown into the liver or one nearby structure like the stomach, or the nearby structures like the stomach or the duodenum, the colon or the pancreas or the bile ducts outside the liver. Outside the liver. Next is the T4. The T4, it indicates that the tumor invades the main blood vessels. So the tumor, it invades the main blood vessels. So it invades the main BV, that's the blood vessels, and it leads into the liver and leading into the liver. So there is presence of the portal vein of the hepatic artery. So there is presence of the portal vein or the hepatic artery, or it has grown into the 2 or more structures outside the liver, or in greater than 2 structures outside liver, outside the liver. Now let's look at the lymph node involvement. So when you're looking at the lymph node involvement, there is NX. NX means the regional lymph node cannot be assessed. So the regional lymph node, it cannot be assessed. Next is N0. N0 means there is no spread to the nearby lymph nodes. there is no spread to the nearby lymph nodes. Next is N1. N1 means the spread is less than or equal to 3 nearby lymph nodes. So the spread, if you see, it is less than or equal to 3 nearby lymph nodes. Next is N2. N2 is equal to the spread which is greater than or equal to 4. So N2 means it is greater than or equal to 4 nearby lymph nodes. Now let's look at the metastasis part. So metastasis, as we know, it is written as M. So M means it is a distance metastasis. So under distance metastasis, there is M0 and M1. So M0 is nothing but there is no spread to distant sites. So there is no spread to the distant sites. So M1 means there is a tumor spread. So this means there is tumor spread. So the tumor is spread to distant sites. It is spread to the distant sites, such as there is liver, there is presence of the peritoneum, or it can involve the lungs as well. Now let's focus on the AGCC stages. So when do you call it a stage 1? So before stage 1 comes stage 0. Stage 0 is when this TIS NOM0. Then comes stage 1 is T1 N0 M0. Stage 2, there is 2A, that is TA 2A N0 M0. Then comes 2B is T2B N0 M0. Then comes 3A. 3A means T3 N0 M0. And 3B means T3 N0. So here TA was T3 N0 M0. Here is going to be T1 to T3. So it is nothing but T1 to T3 N1 M0. So it is N1 M0. Lastly, in terms of 4A, 4A means it is going to be T4 N0 as well as N1 M0. Then we look at the 4B. 4B means it is any TN2 or M0. To learn and grow daily like this, please do subscribe.